Hello, everyone. Welcome to our CMS 1500 and UB04 claims part one lecture in our healthcare settings claims cycle and claims processing lecture. I'm Ms. Blair and I'm going to take us through our lecture today. So what can we expect? Well, we're now ready for the insurance companies to show us the money. I can't do it like Tom Cruise did in the movie, but this is where we send in our claims and we'll await payment from the insurance company. So we're going to define some key terms and we want to know the general purposes. We're going to describe the data requirements. We may touch on secondary claims. We'll talk about some errors, and then maybe talk about the claims processing system. Okay, so let's look at what the claims look like. Now, these are the paper claims, and of course, you know that most of the time we'll be using electronic claims, but I do want you to see that the claims are going to be different and different data elements, even though it's going to be electronic, are going to be required for these two particular types of claims. So the CMS 1500 is for your professional services, physicians and clinics, and anything that's outpatient. It's going to be your fee for service. And then on your right-hand side, it's going to be your UB04, your institutional services for like prospective payment system services and providers. So depending upon what type of provider it is, will determine which particular claim is used to bill the third-party payer. So what happens when it's time to complete a claim? There are rules that are needed in order to complete each type of claim. So let's talk about the CMS 1500, okay? There are, as you saw, quite a few different blocks on the 1500, and each of the blocks have a number. If you would look down at the bottom where we have a block that is number 3. It's the patient's date of birth and I'll say their gender, male or female. And in our book, chapter 11, it gives us a lot of the information as far as how to complete these blocks. So for example, all alpha characters have to be in uppercase. So if you're going to put in a patient's name, it has to be all uppercase letters. Okay. Make sure you don't use an O for the number 0. If you're going to put in a CPT or a HCPC, remember what a HCPC is? It's for services that you would not find in a CPT, such as an ambulance code or a DME for a walker or wheelchair. And a modifier, you wouldn't put a hyphen, which is how you would write it in general. But if you're putting it on the CMS 100, you can't put a hyphen. You would have to leave a space for it. Okay, so like when you're writing your social security number, you usually write XXX hyphen XX hyphen XXXX. Well, the rules say you don't use hyphens or spaces when you're writing a social security number for a patient on a CMS 1500. So all of these rules that tell you how to fill out a CMS 1500, if you do not follow them, it will cause the claim to be rejected and sent back for correction. So you may think that, oh, these are silly rules and I don't have to go by them. Yes, you do have to, because you don't want to see these claims continue to come back and then find out it was something because it was just a data entry error And that's not something that you really want to see come back. So um, there's other requirements that you have to know about for the CMS 1500. Um, how do you enter the patient name and the policyholder name? Well, remember, the policyholder is the person who has the insurance. It's the person who signed up for the insurance. They pay the premium. They are not always the patient. For example, if you're the mom and you took your child to the pediatrician's office, well, you're the policyholder and you're the and the baby or the child is the patient. If you mix up the names and put them in the wrong block, it's going to cause your claim to be rejected. Um, when you enter the provider's name, when you enter the mailing address, a telephone number, okay? When you put in ICD-10 CM codes, when you put in the CPT codes, remember that CPT and HCPC codes have 5 digits. If you put in too many digits or not enough digits, it's going to cause your claim to be rejected. So when we complete claims, it is very detailed. It is just like when we code for services. It is a very detailed type of procedure that we have to go through. Okay, so what else is there? Um, we were just talking about diagnoses. So now, in block 21 is where we deal with diagnoses. A maximum of 12 diagnosis codes can be entered on a claim. Well, you might say, well, that's a lot of diagnosis codes. Well, some people have a lot of medical issues. And there's some guidelines dealing with how many diagnoses or why you would put certain diagnoses on a claim. And you will learn about that. But right now, there's 2 diagnoses codes on this claim. And it's in 21, and you can see 21A and 21B, J180, and R350. Okay. Then there's something called an ICD indicator on the right hand upper corner, and that's a 0. You'll learn about that. Don't worry about it right now. Now, here we go again with medical necessity. I told you it's always going to be medical necessity. Those diagnoses must be documented in the patient record so that it validates medical necessity of the services. The services are shown in block 24D. And as you see, 99213, that is a CPT code. That is an office visit code. So, patient had an office visit, and the diagnoses are in block 21A and 21B. So you could take a whole patient record and you can reduce it down to some letters and numbers, and it'll tell a story. Okay, I think it's pretty cool myself. Um, and then it takes certain people to know how to read that story, and you'll be one of those people that knows how to do that. So what else is there with CMS 1500? Let's talk about place of service. Well, it is just what it says. Where did the service occur? That's important. It depends on the payer what particular place of service codes you do use. For Medicare and probably a lot of other third-party payers, you use a 2-digit. However, Blue Cross Blue Shield, they have a 1-digit code. So you have to know your payer in order to figure out what goes in particular data blocks. So, inpatient hospital, 21. Outpatient hospital, 22 for Medicare. An office, 11 for Medicare, but 3 for Blue Cross Blue Shield. A home for Medicare is 12. For Blue Shield is 4. So if I'm reviewing a claim and the place of service says 11, which is home, but when I look at the CPT code, it tells me that the service was an inpatient hospital visit. Now there's a disjoint. Did the service happen in the office and it was coded incorrectly? Or was it coded correctly and the place of service is wrong on a claim? So these are the type of things that you will learn to think about as you become more experienced in the coding world. So, how about CPT? When we report CPT codes, we want to put the CPT code that's going to give us the highest amount of money reimbursed on the first line. You'll learn that. And then there's also a place where we put our modifiers. And if you can remember, a modifier doesn't change the description of the code. It just gives us some additional information about that particular code. And so there's a lot of information that has to go on a claim. And remember that the revenue cycle starts when a patient calls in to schedule their appointment or they register for an appointment or a procedure. So a lot of information that goes on this claim comes out of the system that the registration department or whomever put in information at the patient's visit put into our system. And therefore, all along the line, information is important because it's going to affect our claims and that's going to affect the bottom line, which is getting reimbursed for the money or reimbursed for the services that the provider has rendered to our patients. Now, remember one other thing. Providers, physicians, and doctors, they do not complete claims. When you have homework or assignments or tests, and it says the provider, did this, the provider did that, you are representing the provider in those scenarios. You work for the provider. You are the biller. You are the coder. And that's why we're here learning about all of this information. The provider puts their information in the record. The coders go in the record. They read it. They take it and they enter it in these claims and these numbers that you see here on the screen. Okay, so that's one thing. Please remember, they don't bill. They do not, and when I say they, the providers, the doctors, they don't code and they don't bill. You do that. That's what you're here for. That's why you're here to learn. And so always remember that. Okay. So what are we going to do now? We're going to wrap it up. The lectures in chapter 11. Our next lecture, we're going to complete our review of the CMS 1500, and then we're going to continue on with the UB04. And until then, you know what to do. Ask for help when you need it. Make sure you do all of your assignments and call tech support for any computer problems that you are having. and I will see you on the next lecture.